Hi, welcome to Inside the Moms Club, where being a mom is the coolest place to be. Here in the Moms Club, we believe that what embarrasses you now will make a great story later. And let's face it, if you don't laugh sometimes, you're going to cry. Join us in having a good laugh together. I'm Monica Samuels. You are now inside the Moms Club, your private destination for all things mom. Hi moms, welcome to Inside the Moms Club. I'm Monica Samuels and I'm here today with my special co-host, Raha Dixon. Hi Raha.
Monica. Hey.
Thanks for helping out today. I'm here in Los Angeles. I came out here and I'm so excited. And I didn't know what to anticipate because last time I was here in Los Angeles, the rules were pretty locked down.
Yeah.
And so we stayed at the Hilton overlooking Universal Studios, which was totally closed, which is sort of a surreal thing to look over and see nothing happening over there in an amusement park. And then they had the restaurant for the hotel was set out in the parking lot on some folding tables.
Yeah.
So, and then the waiters and people sort of forgot that we were out there because I guess they weren't used to that.
Oh, man.
And it was a different experience. But
yeah.
Coming here this time, I really wasn't sure what to expect because, you know, living in Texas, we all have different judgments about different states, like what's going on. So in Texas, we all think that in California, everyone's being, held in their house and can't do anything. And I'm pleased to report that is not the case. Evidently, they have changed some of the rules. You don't have to wear masks outside anymore.
Right.
And you only have to wear masks inside if you're in LA County. So if you step across the line, the county line, I guess COVID doesn't. It's just COVID's an amazing disease all the way around.
I underestimated how much COVID has changed me personally, and I bet you all of you guys are feeling the same way. All of us have been changed somehow. I recently went to a wedding. It was an in-person wedding. It was mid-January, right in the middle of the Omicron surge. They had planned it from October, the year before. So when the time came, I didn't realize how much COVID had changed me till I went to this wedding. And the groom comes, he's like, come to the dance floor. And I was like, I can't. And now I am always on the dance floor. Anyone who knows me, I'm the last one to leave with my feet bruised and blistered. But I couldn't bring myself to dance. I saw people on the dance floor without masks. I started freaking out. And I realized, wow, I've really changed. And so I think for all of us to recognize that every single person has somehow been impacted by this. Some sort of trauma has left them with some sort of inability to do something. So we just have to be patient with everyone.
Yeah.
And, people with COVID trauma look exactly like people without COVID trauma.
Yeah.
So you'll never know.
No, I agree. I mean, I have a friend who was a cancer survivor and actually lost her mother during COVID. And she came to a UT football game. Actually, her husband had kind of lied to her a little bit about that they were going to be in a box. So she said, I understood that I was going up in a back elevator to a box and there were only maybe like 8 people. Yeah. There were 40 people in there. Ooh, and you could tell she was freaking out, that she hadn't been out of the house in 2 years.
Yeah.
But I understood why she was feeling those feelings. The question is, how does she get to the place where she feels comfortable again? And I guess that's the thing. We have to give each other space to be who we need to be. Like, I'm going to confess myself, I have always been a huge germaphobe. Everybody that knows me knows that. So I don't want to say that COVID was in my wheelhouse necessarily, because that sounds terrible.
Oh, man.
That's terrible. But I do appreciate the hand washing and social distancing and things. I think, that's me. So wearing a mask wasn't the worst thing that I've ever done.
Well, and when I was 10, I didn't know how to wash my hands. But my son is 10, and he knows how to wash his hands. Mm-hmm. So there's some silver lining. But it was it's just been a real traumatic 2-3 years. And I think we have to be so careful to be so easy on each other.
Yeah.
Don't be hard on each other, because we're all potentially walking landmines.
All the way around. We have to be, as individuals and also as states, like we're going to, California needs to give some grace to Texas and vice versa.
We can't judge anybody.
That's right.
Nobody
We should
can
not
judge
do that.
anybody.
So, well, we are very excited today to have a very special guest to talk about some of the issues related to COVID as it pertains to children and mental health. Our guest today is Dr. Roshni Koli, and she's the Child and Adolescent Psychiatrist and Medical Director for Pediatric Mental Health Services for Dell Children's Medical Center in Austin, Texas. She's an assistant professor of psychiatry at Dell Medical School at the University of Texas. And she currently cares for children and families on the Consultation Liaison Service for Mental Health Unit and the IOP, and she is also a mom. So we're very thrilled to have today Dr. Roshni Koli. Welcome, Dr. Koli, to the Moms Club.
Thank you so much. It's great to be here.
Thank you so much. So what we really want to hone in on all of the, not all, we don't have time for all, unfortunately, but some of the mental health issues that kids are dealing with and how we as moms can help them navigate them. And I guess the first one that I've heard so much about is, and have some experience with, is anxiety with kids. And that seems to be really on the increase. And even trying to find help for children. There's so many kids that need to see a therapist or feel like they need that and are really having trouble even finding someone because there are just too many patients potentially and not enough physicians. So what's been your experience with that? And what do you recommend? Like, what are some of the warning signs that parents need to look like? When should they actually see a therapist? Or how can they help their own kids deal with some of the anxiety around COVID?
First, Monica, I'm so grateful that you all are talking about mental health because it is impacting our community in such a significant way right now. I think the first thing to recognize is that this mental health crisis that we're seeing with our youth is something that was starting and escalating way before COVID. Even pre-COVID, we were seeing about 1 in 5 children or adolescents were experiencing some type of mental health concern that was affecting their functioning. And suicide has been increasing and now is the second leading cause of death for kids and adults ages 10 to 34.
Really?
So there was a mental health crisis that was developing pre-pandemic. And then in the midst of the pandemic, we all have experienced such a disruption in our everyday lives. And nowhere do we see that more evident than in our kids. For kids, one of the things that oftentimes gives them a sense of normalcy or routine is going to school, spending time with their friends, playing sports. And then when COVID started, really all of that got disrupted. So all the things that kids were used to relying on for just growing and developing, all of that kind of got turned upside down. And so anxiety is really a normal reaction to that. Anxiety in the midst of health-related anxiety, we know that in the midst of the pandemic, about 140,000 children and adolescents lost their primary or secondary caregiver. So there's some real health-related anxiety that is very valid right now. And then I think, as we started looking at things like virtual or online school, that didn't work well for everybody, especially for our youngest kids. So really having that disruption in routine, I think we really saw some pretty prominent anxiety and increase in periods of sadness and depression. You asked about warning signs, and I think, warning signs of anxiety or sadness or depression is going to look different based on the age of the child. And so for a younger child, they may not be quite as verbal or articulate with their words. They're really going to show us how they're feeling with their behavior. Right. So for a younger kid, if they're in distress or they're anxious, they may have more difficulty sleeping at night. They maybe want to be closer to mom or dad. They may not be eating as well or having nightmares. You may see more tantrums, just kind of recognizing that they don't want to do things like going outside and playing the way that they usually would.
What are your thoughts on, you mentioned kids might become clingy to mom or want to sleep with them at night. What are your thoughts on staying with your child or literally until they fall asleep? And some people say that's coddling, that they have to learn to self-soothe. What are your thoughts on that?
There's not a right or wrong. I think that you really have to look based on the family culture and dynamic. I think kids need that sense of security from their parents, but each child is going to be different in terms of what gives them that sense of security. And I think you've got to look at what works for your family. Some kids, staying with them until they fall asleep, that could take 5 or 6 minutes. For other kids, that could take several hours, and that could cause a significant disruption in that family time and dynamic. And so I think kind of really recognizing what does your child need and how do I as a parent provide that in a way that causes the least amount of disruption. And maybe even for a child who's a little bit more clingy, kind of thinking about a graded or gradual approach, starting with being with them until they fall asleep, and then kind of coming up with some special routines that help them to feel safe and secure and comfortable. And then slowly having less and less time where you may be there. Just so that they start to recognize that they can do things to help themselves feel calm and safe as well.
I like that.
You were saying that this problem existed pre-pandemic. And so one of the things I know about pre-pandemic, a lot of things we were talking about with kids involved bullying. And a lot of it involved social media and that impact on kids, and in fact, bullying associated with that. And with the pandemic, for the kids, a lot of times their only outlet to see their friends was through social media. And the other day, it was the saddest thing. I don't even know the family, but I'm looking through Facebook and I'm reading a memorial to a 12-year-old boy who had just committed suicide over bullying. Yeah. And here we are in the middle of a pandemic, and how horrible that is. So how do parents navigate that? Like, when to keep their kids engaged with their friends, but in some cases they can't go to school, they're in quarantine, or I mean, what do you suggest there? I mean, how do we navigate that?
It's tricky. Social media absolutely can have been a way in which people connect. And I think definitely for our kids and adolescents, social media has been an important way of connecting with the world around them. And at the same time, there are risks associated with social media, definitely in terms of cyberbullying, risks of, human trafficking, risks related to all kinds of things in terms of TikTok challenges that may result in more risky or impulsive behaviors. So I think it's really important that as caregivers, as parents, as adults involved in kids' lives, that we have an idea of what they're doing on social media. Having some really thoughtful supervision, thoughtful monitoring. It's normal for adolescents to want some of their own privacy, absolutely. But at the same time, you want to know what they're exposed to on social media. And making sure, I think most importantly, that they have an outlet, that if something's not going well, if they're in distress, that they have a good relationship with an adult in which they can reach out for help.
Are you saying that maybe that's not the parent, maybe that's an aunt or an uncle, or because you said an adult?
It could be, I think it could be really any trusted adult. Really when we think about raising children now, we think about a community. And so it could be a coach, it could be a teacher, it could be an aunt or uncle, it could be their best friend's mom or dad. I think it could be a variety of any of those people. And, we want our kids to have a variety of different adults that they can trust and turn to.
Yeah. What steps do you suggest a parent take? Like, I have a child in college right now. And when your child contacts you and says, I feel like I'm having a heart attack. Ooh. Well, you're thinking, you're 18 or 19 years old. I know you're not having a heart attack, but you probably need to visit with somebody. I mean, as a parent, you're not there. What's the best way to help them get through what they're dealing with at that particular time?
So, Monica, I think what you're probably describing is that it sounded like your concern was pretty high for anxiety. And, a panic attack can feel like a heart attack. When somebody's in the midst of a panic attack, that can feel pretty intense. It feels like you can't breathe, like your chest hurts, that you feel like something really awful is going to happen. And so I think the first thing really is just to make sure that they know that that you're present, that you're there, even if you're not right there in person, but that you can provide this sort of sense of comfort and support. And then really start to get them talking about, what's going on? Where do we think this anxiety is coming from? Can we put any words to what you're experiencing? And then encouraging them to get help. I think for a long time, there's been such a stigma related to mental health. As for a long time as a community, we've said, listen, if you have depression or anxiety, that may be more taboo than if you have cancer or if you have a heart attack or a cardiac condition. And I think what we're learning more and more that mental health is health. It is just as important, if not more important sometimes, in our overall well-being. And so really kind of decreasing that stigma and saying that we're not meant to do this alone. If you are struggling, let's figure out what are some supports in which we can get you some meaningful help.
Yeah, I love that. I don't know why our brains have always been attached to our bodies, but somehow fixing the brain has always been a separate thing to fixing the body. I never understood that. Mm-hmm. Why is it that we've had this separation, whereas it's just this one thing this whole time?
Where the stigma came in from all of that is kind of, it would be interesting to explore that.
Yeah.
I've also been curious, you mentioned kids who've lost their primary caretaker. They may become orphans through the pandemic, or even lost, like some of the moms on the Moms Club were all friends who, our kids graduated in 2020 when the pandemic started. And so they had no prom, they had no real graduation, and they started their college career locked down somewhere, in some college somewhere. But like my son, every time we FaceTimed him, he did look like he was in a hostage video. He was like, they're wearing the same clothes. He's got a cinder block wall behind him, and he doesn't look very happy. And so they feel like they've lost something that was really important that they can never get back again. And the way I explained it to my son, I tried to, is putting it in perspective. I said, Chase, on December 7th, 1941, a lot of kids your age, their lives were changed by things that were out of their own control. But they had to deal with that. Now that's, intellectually, that makes a lot of sense, but that still doesn't emotionally help you deal with the fact that you feel like you had some loss. So how do you help your children deal with, or help children deal with grief, either like they physically lost a person in their family who's very important to them, or they feel like they've lost something they can never get back, and they feel deprived by the fact that they've suffered that loss?
I think you bring up a point that is a loss. I think loss of milestones is one of the biggest aspects of grief that we've seen in this pandemic. So loss of graduation, first semester of college, all of these things that we get excited about with senior year of high school, and all of these events that I just make up our everyday lives. I think the first step is really just recognizing how big of a loss that is. And not, just allowing people to feel what they're going to feel, allowing them to feel disappointed and frustrated, maybe angry. Kind of allowing ourselves to feel emotions is really important, not just kind of putting that emotion away, but really saying that, emotion, grief in this makes sense. And then also, I think kind of looking past that is also kind of recognizing, yes, life has changed. There is a lot of differences. We have lost a lot. And, what are some things that may be going well? What are some ways that we've grown as part of this? Oftentimes, especially in the midst of the early stages of the pandemic, when everybody was sort of in quarantine on lockdown, families were forced to spend a lot more time together, right? Spending a lot of time together with kids. And out of some of that, I think that what we did see is we saw some relationships really grow. We saw people kind of have to be more creative in terms of how they spent time together. And so also looking at, what are the things that we can look at with gratitude. And if that grief really feels like it's not going away, like it's really hard to experience any type of true joy, again, how do we seek out meaningful help? And really, therapy can be so helpful in terms of working through some of those difficult emotions.
Yeah. Wow.
Well, we have our Zoomer moms who are joining us now, and they have some questions for Dr. Koli. So welcome, Zoomer moms. Welcome to the Moms Club. Hi, ladies. I'm going to go around and introduce each one of you. First, we have Leslie Harrell, who is the mother of a son and a daughter. We have Helen Savage, who from Arlington, Virginia, who has a lovely daughter, Olivia, who is in the 5th grade. and Jennifer Marsh, who has a son and a daughter. Welcome, ladies. Welcome. So
Thanks for having us.
thanks for joining today. So Jennifer, I'll start with you. Do you have any questions for Dr. Koli?
I do. I have a question about something interesting that's been happening recently. So because Omicron, a lot of kids are already vaccinated, maybe not boosted, and they're all having to go through at school so much testing. And this whole thing has been like waiting for the other shoe to drop in terms of like, I have quite a few, like I've never gotten COVID. Now everyone in my family has, but I can see my son's friends as well as my daughter's friends say, I just want to kind of like a chicken pox party. I just want to get Omicron, get it over with. I don't have to get tested anymore.
Yeah.
And it's like, then it's just over. Right. And I think it's an interesting place they are mentally, where they're like, maybe if I just get Omicron, this whole thing will be over. I mean, get back to normal, which of course is not true. So I'm curious what your thoughts are about that phenomenon that's sort of new right now.
First thought is, I get it. Our kids really want to go back to regular life. I think everybody does, so there's that sense of just wanting that sense of normalcy. And at the same time, you're absolutely right, Jennifer. Getting COVID isn't something, that necessarily doesn't have any long-term side effects. And, there are definite sequelae that are there in terms of having COVID, and we don't know how each person is going to respond. It's not quite, that sort of chickenpox party in terms of once you have it, then it's all done, right? I think part of it is just understanding and, trying to, when we've done all the things that we can, thinking about what's in our control and what isn't. What can we do in the midst of COVID? We can get vaccinated, can get boosted, can wear a mask and wash our hands and use hand sanitizer, be outside more, right? And kind of doing the things we can and what's not in our control. Even if you do all of those things, you still may get COVID. That's the reality of the world that we live in right now. And so how do we provide our kids a sense of normalcy to the greatest degree possible while keeping them safe? So I think if you have kids that have been vaccinated, really getting a little bit more back to regular life and having some good social interactions can oftentimes be really therapeutic and really helpful for them too.
Well, and a lot of these things really aren't in our control. It's the school that's telling you what the rules are and what the testing requirements are. Yeah. It's my daughter goes to school in the Northeast. It's quite cold. So they're indoors and they have to wear masks all the time and they have to test quite a bit. And again, I think they're just like, they're kind of reaching the end of their stamina, like to deal. They're just ready to be done and take the mask off. And, it's funny. She was like, a lot of her friends are like, I'm just sick of having acne on my chin because that's what wearing a mask does to you. Yeah. And, so we're kind of, even though a lot of people have weathered quite well up till now, I feel like some people are now finding the breaking point, like because they're like, I can't believe we're still here.
How do we as parents take the fear out? Because what's driving all this is, I'm scared of getting COVID. I'm scared of getting COVID. How do we take that away so we're operating out of a more loving, gentle space?
I think it's looking at what do we have control with? What can we do? I think it really is recognizing, I think you're right, Jennifer, what you described earlier is that for a lot of people, they were doing great until this point. They were like, all right, we can make it through. And now we're finally at this point where it feels like, again, after Omicron, what's next? Is there another variant? We're going to get through this peak. And what's going to happen next? And I think one of the aspects to think about is that kids are going to get their cues from us, especially when they're younger, right? They're going to look to their parent as their sense of calm and how they feel grounded. And they're going to look to parents to say, how should I respond to this situation? Mm-hmm. So if we as a parent, we as a mom are freaking out and saying that this is terrible and I can't do this and I don't know how to make it through, they're going to get their cues from us. But if we can start to look at, as parents, kind of really start to think, how can I regulate my own emotions? How do I find my sense of calm, my sense of grounding? What do I need to do that? Maybe that is taking care of yourself. Maybe that's getting a bath or getting a massage or getting into regular therapy sessions, spending time with your friends, but doing what you need to so you can get that sense of calm and grounding so you can be there for your kids. That's probably the thing that's really going to help give them that sense of calm the best.
Yeah. So look in the mirror and
Yeah.
you got to do it.
That's great advice.
Yeah.
And going back to the chicken pox party, let's all remember too that I had shingles, so I can tell you that the idea of going out and getting sick is not a good idea.
No.
Just to your point that we don't know about COVID yet. So it sometimes doesn't always go according to plan. Leslie, do you have any questions for Dr. Koli?
I have to make the joke first. That's spoken from a true germaphobe. Well, I mean, this is kind of a tricky question because I think it kind of answers itself, but I think that there's a sub answer to it, which is like, do you think that getting back to normal, quote unquote, is really the big answer, or is there a fallout or a different like level? I mean, because it's like, I mean, normal is not going to be what normal was, but it's like, but to your point about like, how are we as adults responding to it? It's like maybe getting back to normal isn't our language anymore. I mean, and it's like, so what, I mean, it's kind of like getting back to normal. I mean, I think what we're trying to say is not even getting back to normal, is just getting back to a balance where like everybody feels like they have they can have an expectation of something, but like, what should we expect as normal as we move forward?
There's
like
no
not,
normal.
and not necessarily COVID, not COVID. I just mean normal in terms of like mental health and all that kind of stuff.
I don't think it exists, but let's ask our expert.
I agree. I don't know that a normal exists. We thought, remember kind of back to when we were thinking about you're going back to in-person school, it's going to feel normal again. And school wasn't normal, right? We were distancing and masking and had different precautions. Moving from virtual to in-person, that had its own set of anxiety that came with it. And so I don't think that we're ever going to achieve the same type of normal or pre-pandemic normal. It doesn't exist. So what is our new normal? What's our new balance going to look like? And, when we talk about mental health crises was escalating right far before the pandemic. What we've seen in the midst of the pandemic, that kids who were already struggling with anxiety and depression, they're struggling at double the rates that they were pre-pandemic. So the pre-pandemic rates were scary enough. In the midst of the pandemic, we are really in a national mental health crisis. Yeah. So back in October, the American Academy of Pediatrics, the American Academy of Child and Adolescent Psychiatry, and the Children's Hospital Association put together a joint statement and said, look, we are in a national mental health crisis for our children and adolescents. We have never experienced volumes like this before. Our ERs, our hospitals, our clinics are really crowded. We don't have enough resources to take care of all the mental health needs that exist for our youth right now. So what are we going to do as a community to come together and really try to make some meaningful change?
And what does that look like, though? I mean, like, what are they specifically suggesting, I guess? I mean, I guess that's kind of what I was getting at, is it's like, we can't all become overnight psychologists to our children and to our friends and so on and so forth. Right. And it seems a little cheap to say like, oh, just be there for them. But there's, like, as these statements keep coming out in our world, like, what's the real life rubber meets the road, tangible? Like, what do they expect us to do to help our friends and our kids and our, like I have in-laws in a nursing home. I mean, you talk about feeling trapped and really having mental health issues. It's like, my father-in-law has been there now for 2 years, and like he will not leave. I mean, he won't even, he was like, oh, COVID was going through and COVID's on the other side of this floor, so I'll only walk like literally like 40 yards back and forth in this one little area because he won't go anywhere that COVID has existed. And so he's just become very isolated, and otherwise would have been completely healthy and would be someone just living in assisted living and going to his grandson's baseball games.
Yeah.
I think the tangibles, I think there's two sets of things that we look at. One is recognizing that our community is struggling. And so what can we do tangibly? I think one is recognizing that the stigma of mental health. giving people permission to say it is okay to say that you're struggling. Having anxiety, having depression, struggling does not make you a bad person. It doesn't mean something's wrong with you. It doesn't make you weak. Let's recognize and let's talk about it. Let's check in and have real conversations and say, you know, how are you doing? And not just the how are you doing? And I want to hear, oh, I'm doing well, I'm doing fine, but the real in-depth conversations about checking in and saying, how's your mental health? How are you actually feeling today? Having some real in-depth conversations, I think, is a really good first step in recognizing that, one, that a lot of people are struggling and we're not alone in that. I think the second aspect is really looking at what we're doing as a community. You're right, not everyone's going to go and become a psychologist or a psychiatrist overnight. And the reality is that we were at a workforce shortage, again, pre-pandemic. We have probably about 8,300 child psychiatrists. We probably need at least 12 to 13,000.
Wow.
We're not going to make up that number in a couple of months or even in a few years, right? So part of that is looking at how can we be creative in addressing mental health as a community. So one of the things that Texas did, you know, they passed a really hallmark piece of legislation a couple of years ago called Senate Bill 11, and it funded just under $100 million towards pediatric mental health. Wow. It created a couple of programs that allowed for increased access. One of them is called CPAN, the Child Psychiatry Access Network, in which a general pediatrician or a family practice doctor, when they see a child come in with depression or anxiety or ADHD, they can call this number and they can get consultation with a psychiatrist within 30 minutes. Oh, wow. And they can get advice on assessment, diagnosis, treatment recommendations, referrals to a therapist. We have to close that gap because the people who see children the most initially are pediatricians, right? That's the person that you're oftentimes most comfortable with. You've known them forever. The other thing was T-Chat, and that really kind of looked at school telehealth consultation models in the schools. Let's work on seeing kids where they're at, where they spend the majority of their time. And then really looking at initiatives from a hospital standpoint. You know, our hospital invested heavily in mental health pre-pandemic. So when we're in the midst of this, we're really looking at, we have a whole continuum of mental health services. Does it feel like enough? No, but the commitment is there. And I think that's the commitment that we need to expect from our leaders, recognition and really looking at intervention and treatment.
That's awesome. Thank you. That's good information.
Helen, do you have any questions for Dr. Koli?
Oh gosh, where to begin? When I saw that you're an adolescent and pediatric psychologist, I was just stunned because I've got a 10-year-old daughter, as Monica said, and we moved her from public school to private school right at the beginning of the 2020-21 school year. So we pulled her out. Pandemic wasn't, online learning wasn't working for us. And I don't know if this is a pandemic. I mean, it started during the pandemic, what she does, but she has decided that I have to apologize for basically breathing. Everything I say, everything I do, she wants an apology for me. If she doesn't like my tone of voice, if I ask her about why did you get an F on this in school, which she did great in school in person last year at this same school. And now this year she's not doing, she just doesn't turn in assignments. She's not, we've talked about sending her to a therapist. We sent her to one back actually when she was in kindergarten, first grade, because of just the nonstop temper tantrums. Well, now she's 10 and she's like 5 feet 3 inches tall, and she's a smart girl, but it's just, she is to say it's Clash of the Titans, and I had my own mother-daughter struggles with my mom, but it wasn't until I was 13 or 14. I wasn't expecting it at 8, 9, and 10. So and then I've got on the other side an almost 84-year-old mother who's going in to have surgery next week because for a year and a half she did nothing, and now she's got complete artery blockage in her leg, and so she's got to have a bypass surgery. So they don't call us the sandwich generation for nothing. It's just, maybe I need to go work on my mental health. Maybe I'm causing her all her
we all
her
do, Helen.
problems.
We all do.
Our next episode is the mom's mental health.
So thank you again, Dr. Koli, for being here. This is great. And you've already given so many great tips.
Helena, I think a lot of what you described is that it's not uncommon, right? Our kids of all ages are struggling. And I don't know that there is a single reason that that is the case. I think it's probably all of these different factors, right, that are just making life feel really hard and really challenging right now. I think that that is the aspect. We really think about mental health concerns. It's a pediatric condition. Half of all mental illness occurs by the age of 14 and 75% by the age of 24. And so the really beautiful thing about being 10 is that if we can get some really wonderful treatment and interventions in place, we're so moldable at that point, right?
Yeah.
It's so much easier to learn things the younger we are. And so you think about language, right? So my kiddos are in Spanish immersion school, and I am amazed with what they come back with. And I'm like, all this vocabulary, you're learning this language so quickly. Me, in my 40s, trying to learn a language at this point, it is so much harder. My brain just functions differently. For a child, I think the reason that intervention and treatment is so important and so vital is that we have this really wonderful opportunity that they can respond in a way. They can develop new coping skills. They can develop new ways to be able to address their emotions. They can find ways to articulate what they're feeling and, find things that they're going to carry with them for the rest of their life. So I think what I would say is that she's not alone and that there is hope in terms of some meaningful treatment.
Dr. Koli, what are your thoughts on actually apologizing to your child, even if it is for a lot of things? And if that's hard for a parent, what does that tell us?
Everything. She wants me. I literally am apologizing.
Yeah, I'm fascinated by this. Yeah. And what do you suggest? Do you say, you know what? I'm sorry it made you feel like that. I didn't want you. Is that what we do? Or do we try to educate? What's the first thing that we should do as a parent when our kids ask for that?
Right. So I think we have to kind of go back to what does an apology mean? What does an apology mean in our family? Like, is that something that we did wrong that we should be apologizing for? Because you can validate an individual's emotions without apologizing for it.
Yeah.
So, you can kind of recognize that they're struggling, that they don't like what they've heard. They're not feeling like they're in a good place. But if you didn't do anything wrong in that, then sometimes apologizing reinforces potentially the wrong thing. Right? We want to set healthy boundaries in place. Setting limits with our kids doesn't make us mean. Setting boundaries and setting healthy limits is essential for kids. And when we can do it with a sense of structure and high warmth and kindness at the same time, it actually gives them a greater sense of safety.
Yeah, that's really interesting.
I like that.
Kind of along those lines, my sister used to struggle with her daughter who would always accuse her of lying. But she wasn't lying. It's the circumstances changed. Like, she was going to take her somewhere, but 5 things happened that her daughter knew had happened. That the intention had always been to take her wherever, but she suddenly was a liar. So
Yeah.
you can't really give into that, and it's kind of you have to carefully navigate how you deal with that. Well, just really quickly, do you have any suggested resources that moms can turn to or look to if they have questions about, I'm a little concerned that my child seems a bit depressed. I need any places that you would suggest that we invite our audience to look to?
Sure. I think that the American Academy of Pediatrics and the American Academy of Child and Adolescent Psychiatry both have some wonderful websites and some great resources. Here in Austin and Texas, we talked a little bit about CPAN and TCHAT, which is in so many different schools within our communities. At Dell Children's Medical Center, we oftentimes do a lot of different webinars and education about just mental illness in general. And then I would say going to your pediatrician. Your pediatrician or your primary care physician is oftentimes a wealth of information and can really be able to access a lot of great resources.
Well, great. Well, thank you so much for being with us today. It's been really helpful and informative, and I know so many moms out there will really appreciate listening to this conversation. So thank you again so much for being with us. And we'd like to thank our sponsor, Good Company, which is a thoughtfully curated women's clothing and home store fashion store with emerging and established designers, vintage pieces, and home goods. You can find them on Instagram at goodcompany.shop. You can find us at on our Instagram at Inside the Moms Club or on our website. And there's some exciting things happening for the Moms Club. So just be sure and look for everything, particularly on our Instagram page. Check it out. Thank you, Raha, for co-hosting today. This has been incredibly interesting.
Oh, yeah.
And thanks, moms, for being with us today. Our time is up, unfortunately, but we're going to be back next time with celebrities and extraordinary moms just like you. We know your me time is precious and valuable. Thank you so much for sharing it with us. And remember our motto, which after listening to today's program is so important. If you don't laugh sometimes, moms, you're going to cry. So keep laughing and having a good time. Thanks for joining us, and see you next time inside the Moms Club.
Thank you, Dr. Koli.